Ricardo, hi, and thank you so much for joining me for a discussion here on Faces of Digital Health to talk a bit about the regulation of AI in healthcare, what you're doing with Health AI. But let's start with why you're interested in AI in healthcare. To a degree, obviously, everybody needs to be interested in that, but you have a very rich career behind you. You were a politician, a doctor. You worked in Portugal in several posts. You were introduced to politics in 2000 and also got a very special place in the Obama Foundation, right?
Yeah.
So tell me a little bit more about that and how you decided to work with Health AI and help governments with good implementation of AI in healthcare.
Well, thanks for having me first time here on Faces of Digital Health. So very, very happy to join you in this conversation. And that's a pretty packed up question. But my story starts as a kid. My father was already working in computer science, and he taught me how to do some basic programming in basic language back when I was 6 years old, and that got me hooked on the power of technology ever since. But as you said, I followed the path of medicine, and having worked in infectious diseases as a practicing physician for several years. But throughout those years, I was always engaged on the side of digital health and technology, having worked as a consultant in that field, in the field of academia, also in the frontier between global health, health policy, and digital. I was also always very passionate about policy, and that I ended up being, as you said, involved in local politics, and then later a member of the National Parliament in Portugal, where I served for 4 terms, always on the Health Committee and Foreign Affairs Committee. And I actually founded an NGO in 2017 called the Unite Parliamentarians Network for Global Health, which is a network of current and former legislators that are committed to science-based policymaking in the field of health. Today, it's more than 500 legislators from more than 116 countries that come together through that network. So before my time at Health AI, I was already in this amazing intersection between health, policy, technology. And the main driver of everything I've done has always been focused on this premise that I want to do something for society, as many of us do. I believe that the most impactful way to do so is precisely by ensuring access to better health, quality of life, and well-being for citizens, as that is clearly, and all the studies show that, that is the backbone for economic development and prosperity, without which you are not able to elevate people out of that out of poverty, and to ensure that those that live in most vulnerable situations actually get a fair chance. And in a very unequal world, and a very multipolar world, I believe now more than ever, health is a top priority. When the opportunity came to be able to lead this amazing organization, now called Health AI, the Global Agency for Responsible AI in Health, I I took on that opportunity because I am a strong believer that we are at a break moment, a threshold, if you will, between breaking down the broken disease-driven health systems of the past towards building health systems focusing on health, quality of life, and well-being in the future. And that is only possible with the power of artificial intelligence, given that we have to redesign and rethink the health systems altogether, and the power of data can be the driver for that. But the power of data can only be harnessed if we have the tools to do so. And I believe artificial intelligence, which is an umbrella terminology, brings together all of the opportunities for that transformation. And so, this is my third life after working as a doctor, after working in politics. Being able to contribute to the global good through this nonprofit mission is quite a unique privilege and opportunity.
Mm. So let's talk about Health AI. The mission of the organization is to advance the development and adoption of responsible AI solutions in health through collaborative regulatory mechanisms and global standards. How far have you come to date? What are some of the concrete measurable milestones that you've achieved so far? So what are you most proud of so far?
Yeah, so about 18 months ago, we presented our new strategy, which led to the rebranding of the organization. Before we were more focused, before my time as a research collaborative, we transformed ourselves to becoming more an implementing partner for governments. An easy way to think of Health AI is as a bridge that connects on one side of the bridge the international organizations that define guidelines and standards. We don't do standards. And so you can put in that bucket WHO, ISO, UNESCO, OECD, and others. And on the other side of the bridge, you have the authorities that each country has to assess and validate these AI tools for their health systems. Today, what is happening is that we have a lot of pilots out there, but most technologies driven by AI are not scaling because the governance mechanisms are truly not in place. Of course, in most of the most advanced countries in the world have very strong and well versed regulations when it comes to medical devices, and a lot of AI fits into that bucket. And so, making sure that AI as a medical device is put in place in countries where that is not the reality yet is part of our mission. But then you have what we call the duality of AI. So you have the AI that falls under the definition of medical device, but then you have all the other AI tools that legally are not medical devices. That's where we also need to find ways to, how do we address that technology? It doesn't mean it has to be regulated, but governments are struggling on know how to deal with it. They're struggling on how to govern it, if you will. How do you put in place post-market surveillance to build trust and ensure people are safe? And a very critical issue is who's going to pay for it? At the end of the day, billions are being used to build these tools. I mean, we're talking about a market that the estimates is that the market cap for AI and health alone will represent nearly $500 billion in 2032. So these billions that are being pumped in and the expectation of the market paying back will only be possible if we find a model where reimbursement of these technologies through health systems is possible. Today, most countries are struggling because they don't know how to assess the quality and effectiveness of the technology and then determine how to pay for it. And so working with governments as a technical partner, providing that kind of assistance is a key element of our work. The way we envision that is to build a global regulatory network. And so we will be announcing right after the summer. During the summer, we will be announcing actually some of the countries that will be joining that global regulatory network, and the full 10 pioneer countries, as we call them. The full list will be announced at the end of the summer, beginning of autumn. And those 10 countries are where we are going to start to develop our implementation work in terms of providing the capacity strengthening and technical assistance. The countries that come on board, they will be able to benefit not only from that technical assistance, being able to initiate a maturity journey independently if they are very advanced or starting at a very latent stage and still starting that maturity journey. We will design the path with those country regulators to go down that journey so that over the years they can build up the maturity necessary so that they can assess and validate and scale the AI technologies within their health systems. These countries will also get access to two important tools. One is a global early warning system. So as each country already has incident reporting, typically, well, at least the most advanced countries, when it comes to harms or risks related to AI, those reports, although in theory should be shared, they're not really being shared among regulators. So we're creating a platform that, in partnership with the regulators, we will be raising red flags if something goes wrong in Singapore, in Brazil, or in Zambia, so that all regulators in real time can get that information to act upon that information, building trust towards the technology, helping the companies fix the problems early on so that ultimately we are being more successful, avoiding harm and mitigating risk. The other important element of our work is a directory of AI solutions. So as the regulators approve tools for their markets, those tools will appear on one single directory. You can think of it as a global marketplace where you'll be able to see what technologies are out there on a global scale, who developed them, and which regulators have already approved them. Finally, we're very proud to have launched last December the Health AI Community of Practice. This community brings together now 25 governments and growing, but also more than 300 partners from academia, patient organizations, and civil society movements, even industry, so that we can foster a serious conversation around the governance of AI and hopefully through that co-create a future together. And we're going to bring all of those members together in an in-person meeting on December 2nd in Nairobi, Kenya, the day before the start of the Global Digital Health Forum that will be taking place also there. And so it's a unique place and opportunity to discuss our niche, if you will, which is precisely this intersection between the governance of AI and how to govern it to improve the health outcomes of the communities in each country and each society that we are working with.
Mm-hmm. What kind of caught my attention was when you mentioned post-market surveillance, which is absolutely logical. The secret obviously is in the details. How do you actually manage that? How do you plan on assuring the capacity to manage all the things that you mentioned, the assurance labs, not the assurance labs, the surveillance system, the network, the support, the library of solutions? The reason I'm asking that is because it seemed that in the US, the Coalition of Health AI was leading the way with the idea of assurance labs, which they were supposed to launch last year. But now in May, based on the reports from STAT and others, the idea is kind of dead. So they're pivoting from that, which just shows how difficult of a task it is to regulate AI and also revalidate it.
Yeah, I think it's very important for people when they hear regulation, they always think that regulation will hold back innovation. What is very important is for people to understand that in healthcare, it's exactly the opposite. What we're seeing is a lot of pilots, but to scale the technology at a systemic level, you need governance in place. You need to have health technology assessment. You need to have post-market surveillance, or else the payers, the governments, the insurance companies are not going to chip in. And if they're not paying, no one's paying at the level that will allow scalability. And I believe that a lot of even big tech companies are understanding that healthcare is a different beast in a way. And so that being said, we've always believed that HTA and regulations and governance, because a lot of these technologies don't actually have to be regulated per se. There can be a registry system, there can be guidances, and each country has their own model. We've always believed in the principle that, first of all, and I think COVID showed us this clearly, we need to invest in building local capacity, sovereign capacity. So we are not an international organization going in to do things for the government. We are a technical partner, but at the end of the day, when we leave, if we leave any day, those governments will be stronger because we were able to work with them. And I think that has to be a priority for any organization working in global health. The other element that I think is critical is supporting governments also in trying to address those major challenges, precisely as you were saying, around post-market surveillance and also on pricing and reimbursement. So on the post-market surveillance part, we're not the ones doing the registration of incidents. That would be an impossible model. And so what we've designed as a partnership model with the countries is that each country has their own domestic incident reporting. Those that are less mature, we will provide the technical assistance so they can build in those systems. Those that are most advanced, we can continue to take them to continue to continuously improve their maturity. We are the connection point between those sovereign states in the sense that they are the ones reporting to our platform, and we secure that that information is shared safely among the regulators. To do this, we have built up a very robust technical team within our headquarters, And that includes our chief regulatory officer, our chief AI officer, our chief scientist, and then all of the people that work with them. And of course, this is impossible without the partnership with the regulators themselves, who play a critical role in this kind of knowledge sharing environment. So it's building the trust, it's building the digital and technical protocols, it's building the infrastructure, and we're very much on track of doing so. We're actually pretty much advanced in terms of our own internal timelines. And so that being said, we're very confident that this model is a model that has the future capability to scale, which is another very important piece. We're starting with 10 countries, but we're already thinking of the second and third wave of countries to be able to scale. That being said, of course, there are risks. And one of the risks would be for us to come into a country and try to force a predefined solution. I think that the lessons learned from many examples out there is that that does not work. Anyone working in this space, you can have the guidances, the guidelines, the standards, whatnot, but ultimately we as technical partners, we have to adapt to the reality of each country, and we have to adjust the work plan to the ideological, cultural, political reality of our partners on the ground. And so I think our success as Health AI is keeping that flexibility while keeping focused on the responsible use of AI and always trying to demonstrate in tangible, measurable ways how investing in the responsible use of AI for health is actually the most efficient way to ensure scalability of technology, but also it's the best way for companies to ensure long-term success from a profitability perspective in the markets. So it's trying to find those win-win solutions that we are clearly aiming for.
Mm-hmm. In general, what would you say are the evidence thresholds that AI solutions must meet or will have to meet to be listed in your global public directory? You mentioned, different countries, different cultures, different ideas on what makes sense and what doesn't. I know that you said that regulation is seen as a roadblock, and you don't see it that way. It's still, based on my experience, poses quite a significant burden to a degree on software providers and responsibility. So some prefer to even avoid AI just to not have to deal with the class that they fall in, or in under the EU AI Act to fall in the highest possible category that's most well regulated. So where do you hope to see that the world or countries could align in terms of evidence thresholds?
Well, we will foster from a standards perspective, international standards. And so we do hope to nudge regulators in that direction. To be able to contribute to our directory, we have defined maturity level assessment model for regulators. And so it's very much based on the WHO maturity assessment models that determine 4 levels of maturity. We've adapted it to the reality of artificial intelligence. And so if you don't reach level 1, you cannot yet contribute to the early warning system and to the directory. From level 1 onwards, being level 4, the highest attainable level of maturity, and mind you that these definitions will evolve as the technology evolves, but as you go down that journey, you can contribute. And we will be saying very clearly in the directory what is the country that has regulated and has validated or registered the technology that is in the platform, so that those using that database can see, okay, this was approved in country X that we know has level of maturity Y. And so that allows everyone working in the field, be it innovators, be it the regulators, be it policymakers, be it the payers, to understand what they're looking at. Another tool that we're developing internally, and I can share this with you, I don't believe we've done this publicly yet, is our Health AI Navigator. The Health AI Navigator is a digital tool that brings together standards, guidelines, and so forth into one single platform, organized per modules and designed in a way that is pragmatic in the perspective that it's focused on implementation, right? And so this digital navigator is going to be our tool, our primary tool to design the work plans in terms of designing the maturity journey for regulators in our in-country implementation work. But part of that navigator will be accessible to different audiences, and it's being designed so depending on which audience you belong to, the information will be presented differently. So the three audiences we've selected are innovators, so those developing technology. The ones that you mentioned are very frustrated sometimes. The policymakers who have to write the legislation, and the regulators who have to regulate. We believe this is very important to create a common language. Those developing the technology need to know what are the expectations on the other side. Many technology companies, especially those that don't have experience in health and are getting in this space, sometimes when developing the technology, they're just focusing on solving a problem. They're not looking in terms of how do I ensure access to market down the road when I'm ready to deploy the technology? How do I ensure that my technology will get reimbursed? That has to be by design from the start. And so we're hoping that we'll be able to contribute to the ecosystem precisely by supporting the innovators in going down that journey. On the other hand, I see a lot of frustration from innovators when dealing with regulators that don't have proper governance in place. And so the default is, in the absence of governance, let's reject, or let's postpone, or let's just put it in a drawer. And that is highly frustrating for those that have raised capital with venture or angels or whatnot, and that have to respond to those funders and need to get to market and need to get the numbers moving in the direction they need. And the truth is, if you hit that wall, it's very difficult. And so building these governance models designed to scale technology and innovation is critical. And so that's hopefully what we're doing, finding that right balance between the responsible use of AI, and so the issue of safety and other principles, but also at the same time, making sure that people can benefit from the technology. One question, I ask myself many times is, how ethical is it that a technology that can improve outcomes not being put in the market because we haven't been capable to put in the right governance in place? And that's happening today. So we're hoping
Yeah.
to address that challenge.
It's a great thing to bring up because I was just thinking last week how, on the one hand, AI is here, clinicians are using it, patients are using it. It's probably less AI solutions are developed because if you want to be clinically rigorous, you have to cover many edge cases, and in the end, it can feel so overwhelming that you just want to you don't want to take on the liability as a company for a solution for every single edge case. So I guess my wonder is, are we gonna come into this state where AI is used in a completely unregulated ways because you use ChatGPT or other large language models that aren't well attuned 100% to medicine, but are still useful enough for people to have benefits from them?
Well, that's happening today. Let's be honest. I mean, in every emergency room around the world, doctors, nurses, healthcare professionals are using some form of large language model. Just like when I was in the ER 20 years ago, I was using Google, right? And that wasn't regulated. But what I'm concerned about is not them using the technology, is that people may be using the technology unaware of the risks and unaware of how to deal with issues like hallucinations, like bias, like data privacy, and what kind of information can you put on a large language model? Are you sharing personal data of a patient on a model that will then be using that data openly and publicly to train the models and share that information in other forms down the road? I believe that through our work of building this capacity and strengthening the local ecosystem in each country, we are creating the necessary capacity in those countries so that they can actually promote the educational pathways for healthcare professionals, for healthcare managers, and so forth, to learn how to deal with these different technologies in the market, and also how to decide what can be used, clear guidelines on what kind of tools should not be used. And you're not going to be able to regulate everything. But even for the general public to understand, if you download an app from the App Store that tells you that it's going to support you on mental health, what kind of precautions should you have to make sure that that app is trustworthy, right? And so it's a literacy issue also that needs to be addressed. But if you're dealing with regulators and governments in many cases that have very little knowledge and capacity, or even bandwidth in terms of resources to deal with AI, how can we expect them to be able then to support that whole transformational process when AI is just growing in an exponential growth, right? So that's, I would say, one of the biggest challenges that we're hoping to address. But mind you, there are major challenges that no one knows how to address yet. And, for example, regulations typically compare new technologies with the gold standard. And if the technology is worse than the gold standard, it's many times not approved. The question I ask is, we work in high-income countries, but also as a nonprofit, a lot of our mission is focusing on building capacity in low and middle income countries across Africa, Latin America, Southeast Asia. And one must ask themselves, if we have a tool that performs less than the gold standard, but the gold standard is far from being available in a certain market, in a certain community in rural Africa, how ethical is it to hold back the access to an AI tool that would improve the outcomes of the health community worker in that rural village in Africa because it doesn't meet that gold standard? Can we actually realistically and ethically use and demand the same kind of rules that we demand in a high-income setting in those low and middle income settings? That's a very challenging question. It's a very ethical question. But even in high-income countries, you have tremendous inequalities. You may have access to certain technologies in rural and urban areas, but then you go to the rural parts of even Europe, and people are completely abandoned without access to health. And so these are debates that some of them do not have direct answers. That's why we created the community of practice, and we work bringing together the different stakeholders, and the private sector has to be part of that conversation, because we have to build the solutions together. And that has been the ethos of Health AI from the beginning. It's really this co-creation of a governance model for the future that can make sure that we never lose focus, that we are completely obsessed that whatever we do improves health outcomes for everyone, everywhere. And it's keeping that focus that I think is fundamental, that every stakeholder in this space does. And if we do so, I believe it'll help the bottom line of those developing technologies.
Absolutely. It's always good to remind yourself what's the why that you're doing something. Can you talk a little bit about the global footprint of Health AI? Which countries are you working with? What kind of differences do you see between countries and governments? Which countries are most advanced? And it's easy to get best practices from them and share them with others.
Yeah, so we are mainly funded by governments and philanthropy. The governments who fund us are the governments of Canada, Norway, the UK, Singapore, New Zealand. Others are coming on board. Beyond that, we are now locking in the first 10 pioneer countries. I'm actually going to be signing the first contract of the 10 next week. But due to confidential obligations, those names will be announced by the governments as we sign. And so next week, you'll hear the first of 10 that will be signed until the end of the summer. But I can tell you that in terms of footprint, we're talking about around the impact that we will have through the countries we will be working with represents over 25% of the total world population. If you do the aggregate of populations of the 10 countries we're going to be working with. So a quarter of the population, 1 in every 5, 1 in every 4 people in the world can indirectly be impacted by the work we are doing, which is a tremendous responsibility. And it's a work that goes across continents. So from Europe to Latin America to Africa to Southeast Asia. And so it's a tremendous effort, and as you were saying, different realities, right? I mean, it's not the same thing to be working with a country like Singapore, one of our funders, as it is to be working with a lower or a middle income country in sub-Saharan Africa, right? And so dealing with those differences, what we have seen is that it's especially an issue of maturity on the medical devices side. That is the biggest difference we have seen. When you go beyond medical devices, I must say it's quite astonishing how most countries, rich or poor, are still lagging behind tremendously.
Mm-hmm.
And so that's one issue. The other issue...
Why? Why do they lag behind?
Well, because in reality, there are no real standards or guidelines. And so it's a very new area. For people who are listening that are less familiar with this space, maybe examples help. When we talk about a medical device, it's something that is defined by law as a medical device. And you can think of an insulin pump for a diabetic patient, right? That's a medical device used for an individual patient. If you're using AI, for example, or generative AI to help you with drug discovery, to conduct clinical trials, to do population health management, to use predictive analytics for public health, for epidemiological surveillance, all of these examples I've just given you, none of them fall under the legal definition of a medical device. And so therefore, in reality, in most contexts, there's no real guidance or guidelines or standards on how to validate these technologies that have a tremendous impact on health. Should they all be regulated? Maybe not, probably not. But you should have guidelines and should know how to deal with the technology. And then the other issue is, how do you pay for it once again, right? And so that also needs to be clarified. Other areas of great difference is the level of maturity of the employees of the regulatory agencies. Most agencies, rich or poor countries, I must say, everyone's struggling in terms of resources to keep up to speed with the technology. But of course, in low and middle income countries, that effort is even greater. We also see on the post-market surveillance capabilities, the high-income countries of the world are much more advanced in incident reporting for medical devices. There's a long journey to be taken by low and middle income countries. Most of them still depend on the manufacturers reporting themselves. They don't have much capacity to do more than that, or even to verify what is reported. So that's a huge challenge. And then we have challenges like some countries, very few still, high-income countries have regulatory and innovation sandboxes, which are extremely useful. Most countries don't. But if you think of UK or Singapore or a few other examples, they have developed very advanced models. But this is something that we believe will be part of the future, but many countries are not there yet. And so part of our support and technical assistance is supporting on the sandbox development, or even on issues like cybersecurity. So this is a huge challenge for many regulators that I would say are far from being prepared for the challenge, especially with the rise of quantum computing, to deal with the perils of cybersecurity attacks. Even the issue we're talking about high sensitive data from manufacturers, from patients. This is critical to build trust, right? And so I'm just sharing some examples of how the different levels of maturity are quite staggering when you look around the world. And then you have different cultural approaches, which is quite interesting. But that's where in our community of practice, we've already had examples of sharing use cases and examples. And I find that to be extremely useful because some people, I've seen it happen, from across the world listening in a session. Oh, so that's how you do it. That's actually interesting. That could help us. And that builds bridges. And that's the kind of world I like.
Yeah. So looking in the future, where do you hope that governance of AI would be in the next, say, 2 years?
Well, I can speak on what depends on us. And I would like to see the 10 countries consolidated as a model, when I talk about the global regulatory network, as a model of how to implement standards and guidelines, how to adapt it to different realities, to be able to start to see the early warning system and the directory in full fruition. And I do hope to see more and more countries engaging in the need to address this challenge. One thing that in a way breaks my heart sometimes is seeing some countries saying to us, listen, we're not ready yet to address this challenge. Those are the countries that need to step up first. Because if they're too far behind, the longer they wait, the harder it is to keep up. And the technology is moving in a speed that, well, it can be either the greatest equalizer of our time, elevating people out of poverty towards better health, or it can be the greatest divider, leaving an important part of the population behind. At this moment, I think we're more on the divider side, to be honest.
Mm-hmm.
But that's why I think efforts in our humble approach, but many others that are trying to do their own thing together collectively, I'm hoping will contribute to ensuring that these kind of technologies can help transform health systems everywhere.
I love that you mentioned basically the dilemma of how much is AI an equalizer and how much is it dividing people even further. And the reason is Jessica Morley at HIMSS mentioned a very important thing, and that is that you can never completely eliminate bias from AI. Not just because the bias exists in the data, but also in the whole pipeline of development. There's something that can impact potential bias, and also not for if we make an analogy, not all drugs are for everyone. So if some algorithms help a specific population, that doesn't mean that we should ban them because they can't address the needs of the whole population. But then at the same time, knowing that women's data is lacking in data that's used for clinical trials, that racial data is missing, agreeing with the fact that let's do what we can with the data that we have could bring to this huge gap where we just say, yeah, create solutions for the privileged populations and leave the other populations behind. So how do you see that this issue could be addressed?
Well, I think it's one of the biggest issues when we talk about data governance and management, and also about machine learning life cycles and ops, and thinking about how we train these models moving forward. Some people defend global pre-qualification of AI tools as a way forward. It's something that I think can be partially achieved, but it will never be the final solution, because the truth is you need local capacity to assess the technology to make sure that the way the models are trained are reflecting the reality on the ground. I believe the future, we're not there yet because the technology is not there yet, but I believe the future of AI in health in particular will be very much based on post-market surveillance. It won't matter so much the initial assessment we do of the technology, but having real-world, real-time surveillance of health data and being able to process that into incident reporting will be much more effective to detect, deviations from the intended impact of technology towards what is actually happening on the ground. You have a promise of a tool that's going to be highly effective in treating cancer patients, but then the real world data is not reflecting that in any way because it was designed on the training data of a population that has nothing to do where the technology is being used. You cannot take 2 or 3 years to detect that, right? You need to get that fast. And so I believe clearly that's the way forward. That's a part of the future. There's also a lot of discussions we're hearing around the role of synthetic data that can play a role in ensuring that the initial training can be done on less biased contexts. But that's a journey that I think will also take a long time, especially for low resources settings. And there are other risks related to synthetic data that we could get into. But just to say that I think the first step is to be conscious about the risks, to be conscious about the challenges, and then to design the solutions to address them. So precisely to help address part of that, at least, part of our Health AI Navigator is a whole module around data governance and management.
Yeah. So if I asked you again, based on all the challenges that we just unveiled, if I ask you again, where do you hope we will be in 2-3 years, would your answer still be the same?
Yeah, I do believe it would be the same in the sense that we would be better than we are today. But once again, how fast countries are able to come on board this journey and to understand their role in addressing this challenge, especially those that are most behind, will determine the future. It's what is fascinating is that we are at the beginning of this intelligence revolution, and we're living it day by day. There's an interesting book called Power and Progress that looks at the evolution of technology over the last 1,000 years. Almost every time a new technology comes out, the technologists say this is going to save humanity, right? And what has happened almost consistently is a tremendous concentration of wealth and power, and not necessarily the impacts, the positive impacts on societies that were promised. The few exceptions, when the positive impact was truly felt by everyone or by the vast majority of the population, was when the technology was designed and deployed from the start with the perspective of equity, of fairness, of what today we would call responsible use of technology. And so the message is very clear. History tells it time and time again with technology. We as humans have the full responsibility to either make this work or to take us down a road where the technology will not serve its purpose and potentially cause harm. And we will always have risk. We're not talking about eliminating risk. We're talking about risk-benefit ratios, but it's creating models that ensure that those benefits always outweigh the risk and that we improve. At the end of the day, the bottom line is improving health outcomes for everyone. As I said, being completely obsessed on that bottom line. If we do that, I do believe that in 2-3 years, despite all the challenges, we'll be in a better place.
Ricardo, thank you so much for joining this discussion and sharing all the insights. We'll definitely speak again to follow up because AI is very lively, it's developing very fast, and I think it's important for us to continue the discussion to also decrease the fear around it and facilitate more action for greater outcomes for more people. So thank you.
No, thank you. I'm looking forward to continuing this journey also with you.